Welcome to The Explainer. If you or someone you care about has ever struggled with recovery, you already know exactly how heavy the weight of those negative emotions can be. It's tough, but today we're going to explore a completely different approach to that struggle together. It's called acceptance and commitment therapy, or ACT for short, and honestly, it is a fascinating, incredibly friendly, and really accessible toolkit for addiction recovery. Instead of feeling like you're fighting this endless war inside your own head, we're going to learn how to pack a mental toolkit that actually builds your psychological flexibility.
Okay, let's dive into this. Here's our roadmap for today. We'll look at the battle with cravings, define what ACT actually is, and then jump right into packing our toolkit. We'll cover riding craving waves, unhooking from your thoughts, and using your personal values for committed action. And finally, we'll wrap up by looking at how to build your daily recovery toolkit in the real world.
Section 1. The Battle with Cravings. Why fighting your mind is literally exhausting.
I feel a strong urge to drink right now. I can't handle this. Look, anyone who's been through the ups and downs of recovery knows this terrifying, just completely overwhelming feeling of a craving taking over. Usually our default strategy is to just suppress it, right? We're taught to push the bad feelings away, to just white-knuckle our way through the day. And in that specific moment, the urge feels massive. It feels urgent and completely unbearable. So our traditional instinct is to panic. We fight it, or we end up giving in because the discomfort feels permanent. But constantly trying to control or eliminate these difficult emotions, it's so draining. It's a losing battle. Because when you spend literally all your energy fighting your own mind, you've got nothing left for your actual life. But what if there was a way to experience that exact same urge without all the panic? That brings us to Section 2, What is ACT? Shifting the paradigm.
So how do we actually shift that paradigm? Well, we do it with acceptance and commitment therapy, ACT. This isn't just a trendy new idea, it's an evidence-based behavioral therapy developed back in the 1980s by a psychologist named Stephen C. Hayes and his colleagues. In psychology circles, it's known as a third-wave behavioral therapy. Basically, that just means it builds on traditional cognitive behavioral therapies, but it brings in a much stronger focus on mindfulness and personal values. The real game changer here is that the ultimate goal isn't to magically erase your bad feelings. That's impossible anyway. The goal is to build what they call psychological flexibility. That's your ability to engage with negative emotions and cravings, to feel them fully without letting them dictate your actions or push you back into substance use.
And this brilliantly illustrates the massive shift in thinking we're talking about. The old way of thinking tells us we must eliminate difficult feelings. We have to defeat the craving, right? But the ACT way says we simply accept those feelings without judgment. It is such a profound realization. You can face and accept your negative thoughts without letting them control your behavior. Substance abuse is so often just an attempt to avoid negative emotions, but it obviously never solves the core problem. So ACT teaches us to basically stop obsessing over the negativity and start making healthier choices right alongside it.
To make this happen, ACT is organized around 6 core processes. Think of these as 6 specific modules or tools that we are packing right into your mental toolkit today. They are acceptance, cognitive diffusion, being present, selfish context, values clarification, and committed action. Therapists usually teach these over an 8 to 16-week program, and as we walk through them, you're going to see exactly how they build on each other to completely transform your relationship with cravings.
Section 3. Riding the Craving Wave. Tools 1 and 2. Mindfulness and acceptance. Let's slow things down just a bit to really unpack these first two. Now, what's really interesting about this slide is this incredibly powerful analogy from the therapy. Instead of fighting an intense craving, an ACT therapist will actually tell you to just notice the urge without trying to push it away. Let it be there like a wave that will rise and fall. This right here is the tool of acceptance. Think about it. A wave on the ocean looks absolutely huge and intimidating as it's coming at you. But what does it always do? It always crests and it always falls. A craving is the exact same thing. It is just a passing physical and mental event. If you don't fight the wave, you can just float on it until it passes. You just sit with the discomfort without acting on it.
Okay, but how do you actually do that in real life on a random Tuesday? That's where tool 2 comes in, being present or mindfulness. Now, this isn't just about sitting cross-legged on a yoga mat. We are talking about actionable daily exercises. When stress hits and you suddenly feel that sharp urge to use, you actively notice your triggers without judging yourself for having them. You use grounding exercises. You focus intensely on your physical breathing, or you physically name out loud the objects in your immediate surroundings. This literally pulls you out of your spiraling thoughts. It anchors you firmly in the present moment, completely stopping that automatic, impulsive reaction to reach for a substance.
Section 4. Unhooking from your thoughts. Tools 3 and 4. Diffusion and self as context.
Let's look at cognitive diffusion. It is so incredibly common in recovery to have thoughts like, I'm a failure because I relapsed. And when we treat that thought as a cold, hard fact, the emotional impact is just devastating. It hooks us. But cognitive diffusion teaches you to step back and rephrase it. Instead, you say, I'm having the thought that I'm a failure. Do you see the difference there? It's amazing. You are no longer the failure. You are just a person experiencing a passing mental event. By creating just that little bit of distance, you strip the negative thought of its power over you.
And that ties perfectly into Tool 4, self as context. This is the understanding that you are a broader sense of self. You are completely separate from your thoughts, your emotions, your past mistakes, and your addiction struggles. You are not your addiction. You are the context, the arena, really, where these thoughts happen. When you internalize this, you stop defining yourself entirely by your struggles. And let me tell you, that is incredibly liberating and absolutely essential for long-term recovery.
All right, let's pick up the pace. Section 5, Values and Committed Action. Tools 5 and 6, Choosing Your Path. Tool 5 is values clarification. I want you to imagine you are facing some serious social pressure right now. You're at a gathering, and your brain is screaming at you, I need to use or I won't fit in. An AC therapist will pause and ask you this pivotal question. What kind of person do you want to be in that situation? It's a tough question, right? But it forces you to identify what truly matters to you. Is it your health? Is it your relationships with your family? Is it your personal growth? By clarifying those core values, you create a powerful, meaningful anchor that is so much stronger than any temporary craving.
So the crucial point is, once you know your values, it's time for Tool 6, Committed Action. This means taking consistent, goal-directed steps in your daily life that actually align with the values you just clarified. And here's the kicker. It means taking these steps even when you feel discomfort or cravings. You might not feel motivated at all. You might be highly anxious, but you choose to attend that support meeting or call a sponsor anyway, simply because it aligns with the person you want to be. You act on your values, not your urges.
Section 6. Your Daily Recovery Toolkit. Taking ACT into the real world. Let's look at the logistics here. How does taking ACT into the real world actually look, especially when it comes to the logistics of paying for treatment? Well, if we look at data from Texas, for example, a standard individual session generally runs somewhere between $100 and $250. However, there are absolutely lower cost and sliding scale options available, usually around $50 to $100. And group-based ACT programs, which by the way are incredibly effective for addiction, are often much more affordable, sitting at around $30 to $100 per session. Plus, it's vital to note that because ACT is a recognized evidence-based psychotherapy, it's typically covered by major health insurance providers, including Medicaid and Medicare, right under your mental health benefits.
Let's move to and see how this builds on other alternative therapies. You see, ACT is rarely used in total isolation. It's usually part of a much broader, comprehensive program. You might see it paired up with cognitive behavioral therapy, which focuses heavily on changing those negative thought patterns, or maybe dialectical behavior therapy, which emphasizes emotional regulation. It also works brilliantly alongside your traditional 12-step peer support programs or medication-assisted treatment. The point is, ACT doesn't replace these other tools. It just adds a wonderfully unique layer of psychological flexibility to your overall recovery strategy.
Well, we've definitely covered a lot of ground today unpacking this incredible mental toolkit. You now know that you don't have to go to war against your cravings. You really just have to watch them rise and fall like a wave on the ocean. So I want to leave you with this final, genuinely powerful question to think about. Will you choose to align your next action with your deepest values, even if you feel discomfort right now? Building psychological flexibility takes practice, for sure, but every single time you make that choice, you are taking your life back. Thank you so much for joining me on this explainer, and keep practicing those tools.